In part 6 of this video series, I'm going to talk about how to treat neck pain in patient profiles A and B. Hi and welcome back to Physiotutors. If you haven't watched the first 5 parts of this video series, make sure to watch these videos first and then come back to this one. After you have done your screening, patient history and examination, you should have categorized your patient according to a different treatment profile. This will form the basis of your management now. For the treatment of profile A, your patient is already recovering according to a normal course. Therefore, your maximal number of treatment sessions should be 3, and the goal is to educate your patient to facilitate an active coping style and to prevent him from slipping into an abnormal course. You should explain that the normal course of neck pain is favorable and that neck pain is not damaging, nor is a rise in neck pain associated with structural damage. Advise your patient to stay active and motivate him to gradually increase his activity, participation and exercise level and to return back to work. At the same time, avoid suggestions that might have your patient stay passive. If neck pain is work-related, he should adjust his workspace accordingly. On top of that, you should explain him how different work-related prognostic factors that we mentioned in part 1 have a negative influence for the suffering from neck pain. In case your patient is not able to work, you can suggest your patient to contact a physiotherapist that is specialized in work-related issues. Let's look at the management strategy for profile B. This profile has an abnormal course with neck pain grade 1 or 2 without dominant psychosocial factors. Therefore, your goal is to influence prognostic factors that are present in your patient and that are related to the delayed recovery. These can be physical or non-physical. So first of all, you should educate your patient according to what was mentioned for profile A. Then the additional therapy of choice consists of exercise therapy with cervical and/or thoracic mobilizations and manipulations. The exercises should be in line with the needs, limitations and goals of your patient. In case this therapy does not have sufficient effect, you can consider the following additional measures: a cervical pillow, cognitive behavioral therapy, kinesiotaping in case of trauma-related neck pain to decrease pain in short term, massages in combination with other forms of therapy for short term pain reduction, heat and cryotherapy also in combination with other forms of therapy, and workspace adaptations in case of work-related neck pain. The guideline disencourages the use of dry needling, electrotherapy, ultrasound or laser therapy. In case of work-related neck pain, the management is the same like for profile A, plus motivate your patient to get in touch with a physiotherapist who is specialized in work-related issues or the company's practitioner to evaluate treatment options if you suspect work-related factors that delay the recovery. If your patient is on sick leave or is less productive, not longer than 4 weeks, ask your patient about arrangements being made with the company's physician or advise him to get in touch with a physiotherapist specialized in work-related issues to coordinate further management. At last, you should evaluate the content of your treatment, commitment to therapy, and the results with an NPRS or PSC scale. Terminate the treatment as soon as your patient's goals have been reached or if there is no improvement after 6 weeks of treatment. If the treatment has not had any effect after 6 weeks on pain or activity level, contact your patient's general practitioner to evaluate further treatment options. Alright, this was our video on the treatment for profile A and B. Make sure to watch our video on the management for the profile C and D by a click on the video right next to me. As always, I hope you liked this video and you give it a thumbs up. Hit the subscribe button if you haven't and follow us on Facebook, Instagram or physiotutors.com. I'll see you in the next video. Bye.